Okay, welcome everybody, and I think we're going to go ahead and get started. I think there's one more person out there that's waiting to come in, but I know some of you have been here for a class beforehand. How many were here for the 5 o'clock class? You two in the back there. Okay, how many of you are here and this is your very last class for becoming a mom? Right back there. I know you are due. When are you due? Next Wednesday, and then we have a December baby back there. Let's see, anybody else due in November? December's, January, okay, some winter babies in here. February, when are you due? In May. Okay, well, congratulations first of all. I'm Stephanie Kaufman and I am the breastfeeding educator up in labor and delivery here at Hutchinson Regional. And is everybody delivering here is my next question. No, where are you delivering at?
Wesley.
In Wesley, okay. Anybody else not delivering here? Okay, where are you?
Wesley.
Wesley. Okay, very good. So I'm going to see, hopefully, most of your faces who are in here. Tonight we thank you. Here's one of our lovely labor and delivery nurses bringing our beautiful baby. Extremely lifelike. Are you here to demonstrate breastfeeding?
No.
Okay.
She was trying all the way down.
Thank you very much. All righty. Well, we're going to go ahead and get started. Obviously, the center of this class is on breastfeeding, but we are also going to talk about bottle feeding as well. And we just want to give you all the information that you need so you can make a decision how you want to feed your baby. And obviously, you are going to make the right decision for you. So, but we're going to first talk about breastfeeding. Is there anybody in here that is not planning to breastfeed? Okay, very good. Let's get started. Okay, the advantages of breastfeeding. Breast milk is the best food for babies. It's a rewarding experience and it has many benefits for both mom and baby. It's digested very easily. It's filled with antibodies which protect against infection. Breastfed babies have fewer allergies than formula-fed babies, and breastfeeding also reduces the risk of SIDS. So is any of that new to you as far as breastfeeding goes? Okay, you've all heard some of that before. It promotes a special bond between you and your baby. Can decrease your risk of breast cancer and ovarian cancer, and can help you lose weight, and it's convenient and economical. How long should you breastfeed a baby? The American Academy of Pediatrics recommends breastfeeding exclusively for the first 6 months after birth and continuing for 12 months. It can be continued for as long as mom or baby desires. So this is always interesting to me, something that I learned in one of my classes, but around the world, so think about around the world, what the average age of breastfeeding, how long is the average that most women, when you're talking around the world? Anybody have a guess? What? 8? Okay. Anybody else?
2.
Okay. 4.7 years is the average age for breastfeeding in other parts of the year or of the world. Now, around here, what would you say the average age that women stop breastfeeding their babies?
18 months.
Okay, 18 months. Anybody else have another guess? 3 months. 3 months is the average length that go ahead.
Does breastfeeding include pumping also?
Yes, yes. Pumping. And you brought up a very good point, because most of the time, why would women start pumping? Because of work. Okay, so in the Western world here, a lot of us go back to work after you have a baby, and so breastfeeding, you are going to have to pump to be able to continue to breastfeed. So that is one reason why some of our breastfeeding lengths of times are a little bit less than around the world. Okay, so if you are planning to breastfeed, one thing we absolutely love to do after your baby is delivered is to do skin to skin. Have you heard of skin to skin? Okay, it's a really hard job that moms, it's our first job we ask you to do, that you put that baby right on your chest. And what that does is it helps to trigger a milk hormone to help bring your milk in. And it is the most comforting thing for your baby. So if you are wanting to do skin to skin, we are usually going to assume that most everybody does. If you do not, it is completely up to you, but it's going to be something we very much encourage, okay? If you're planning to breastfeed, as you know, and some of you have been pre-admitted at the hospital already, but we ask you a ton of questions over and over and over again. You feel like you're answering the same thing. But we are going to ask you whether you're planning to breast or bottle feed, and so that will help us to know which direction to go. When you are breastfeeding your baby, you're going to want to keep your baby with you as much as possible. Make sure everybody knows that's your plan. Recognize the signs and the signals that your baby gives to help you meet his needs. So baby is, you know, with baby being in there with you, you are going to know exactly when that baby wakes up, exactly when the baby is showing some hunger cues that we're going to talk about. And breastfeeding will be very effective that way. Also ask for your nurses to not give any bottles or pacifiers without your consent. Now, if you want them to give a pacifier or bottle, it's absolutely up to you. It is completely your decision, but if breastfeeding and you do not want that, make sure your nurses know, okay? And they will do whatever we can to make sure we do what you want. The first feedings, the breastfeed as soon as possible after delivery. And like I talked about, we're probably going to do skin to skin if you want to. And a lot of times we let that baby just kind of be there with you and you start bonding with your baby. And baby will start showing some signs when baby is ready. And like we talked about, there are some hunger cues that babies do. And at first, babies are very alert. And so that first hour after birth, we are excited and wanting to get that baby to get on the breast as soon as we can and as soon as baby is acting like he or she is ready. Ask your nurse for assistance at any time you need it. And that is what we are here for. That's what all our labor and delivery nurses up there want to help you breastfeed. And so I work and in the daytime, and so I will be seeing each of you at some point if you are wanting me to. And so we usually like to make sure that we're having a good feeding. If you're having problems, I want you to call me. That is absolutely what I'm there for, and everybody up there can help you. Okay, so don't ever feel like you're out on a limb or, oh my goodness, I didn't deliver during the hours that she was here. Everybody can help you breastfeed, and so call for help if you're feeling like you need it, okay? Feel free to ask visitors to wait for you to breastfeed. I will tell you, when I had my first baby, you're so excited. Is this a first baby for anybody in here? Okay, it's so fun. It's fun no matter how many they are, but a first baby is there's just nothing like it. And so your family's excited and your visitors, you have lots of visitors coming. And I had these visitors and I wanted to show this baby off and she was ready to eat. And my husband was putting like a tent of blankets around me for me to do this. And you don't have to do that. Make us nurses be the bad guy and say, hey, can you tell my visitors it's time for the baby to eat? Can you go to the waiting room and give us 30 minutes or go, to Rib Crib or wherever down the road and give us 30 minutes and then come back. Let us be the bad guys, okay? Because your baby is our #1 concern in making sure breastfeeding is going well. And that's what that says down there. We will be glad to limit your visitors for you. The first feedings, they vary in length. Babies are going to feed better when you are recognizing those hunger cues. Okay, so the hunger cues, sometimes it's just opening their eyes and they kind of are looking around and they start licking their lips. They could start rooting on their hands and kind of acting like they want to suck their hands. Moving their head with an open mouth, that's kind of called rooting, and fussing. And really, crying is a very late sign of hunger. So we want to catch those babies when they are showing those very first signs. Hi there. Okay, colostrum. Has anybody heard that word before? Okay, colostrum is what you have right now. So if you were to express some milk right now, if you were to get something, it would be called colostrum. It's in very small amounts. When babies take these first feedings, they are getting colostrum. They get about a teaspoon per feeding. And so when I'm going to show you this little picture here of day 1, what the size of a baby's tummy is, and it's the size of a cherry. Did you guys know that? Is that crazy or what? Now, each day, it's getting a little bit bigger. So by day 3, it's the size of a walnut. By 1 week, an apricot. So really, you don't have a very big tummy there. And so when we say a very tiny bit of colostrum, a teaspoon, it is all your baby needs because that tummy is the size of a cherry that first couple days, okay? The number one question that I get from moms is, I don't think I have enough. And you do have enough. It's not pouring out of you, most likely, but you do have enough. We call it liquid gold. It is so packed full of fat and calories and antibodies and very nutritious. It's very satisfying to baby. It varies in color. It might be yellow, white, or clear. And your full milk supply is going to come in probably in 3 to 5 days. Okay, some people, it might start coming, you might start feeling your breasts start to get full, you know, by the time you're going home. Some people, it might take a couple days by the time you get home. Okay, positioning for baby. The number one thing I think when I walk into a room and we're going to get ready and we're going to get started for breastfeeding is to make sure you as mom are comfortable. Because so many times as a mom, even from the very moment you hold that baby, you're going to do everything you can for that baby. So if that means you have to sit with your leg behind your head to make the baby happy, moms will do that. But when it comes to breastfeeding, we want you as comfortable as possible. Okay, so we have tons of pillows we are going to get you so you are feeling like you're ready to go. You're going to line up your baby so baby is tummy to tummy with you. Now there are lots of different positions for breastfeeding. A lot of times I'm going to show you lots of positions so you guys have lots of options when you go home, and I'm going to tell you some of the reasons for that. So tummy to tummy with baby. Now I know your babies are going to be much cuter than this one. Okay, so tummy to tummy, we are going to, I'm going to show you kind of a cross cradle hold, which is what this is. And so one thing I'm going to have moms do, you have to be willing to touch your boob. Sometimes that is like, oh, I don't know if I want to do that, but you are going to feed your baby. So just get in there. So we have this baby tummy to tummy, and you're going to make a C. You're going to use a C hold. Okay, and you're going to brush that baby's lips across your nipple, and you're going to wait until the baby opens its mouth as wide as possible. Okay, if the baby just gets on the tip of the nipple, like nipple sucking, just the very tip, which that does happen, sometimes they just get going, that is going to cause you to be very sore, and it's not going to be a very effective breastfeeding. It's not going to help that milk and compress the milk ducts. So as soon as the baby opens his mouth very wide, we want the tongue down, and this baby is doing a very magnificent job of opening wide. You're going to bring that baby right to the breast, okay, and get her going. The cradle hold, this is the cross cradle hold. Cradle hold would be like this. And then the football hold. And this works really good for tiny babies, so you kind of have control here of their head and their neck. And then the reclining, or I call this the laid back breastfeeding position, and this is usually the position I will use if I am there for you right at delivery. Okay, so you've done your skin to skin, and what happens is we kind of lay you back, and so you're laying with pillows, okay? And we let the baby lay on top of you, and just a lot of times babies will even move to the breast on their own. It's called the breast crawl pretty amazing thing, but it's a very natural position for the baby to come straight on. You don't have to work too hard.